So, good morning, Dirk Schreckenbach, Dr. Dirk Schreckenbach. I had promised you, remember, you made the film 166, which was called Joints Allergy, What Teeth Do to You. You will find it in the row. Cornelius, who has the same name as me, had put in a tooth, a big, thick tooth, and the tooth is causing trouble. This hay is still very, very friendly because when the tooth talks to you, it's usually not a good thing. That means the tooth is making itself known. And in that sense, it's actually a good thing because we can consider ourselves lucky when a tooth that is causing trouble makes itself known. And this is exactly our topic, why dental interference fields are so often overlooked. They simply do not hurt, and you can't really see them on X-rays. And now we have Dr. Dirk Schreckenbach joining us, who has decades of experience with this topic. And he had so many patients in his practice, but unfortunately, he is currently no longer in Germany. He was so busy that I always had to call in advance to get an appointment for patients. And I could be absolutely sure if I told him, listen, Dirk, in 2001, in that corner down there, there's something, I can find something. Can you please check if there's something there? Then he found something. And our shared intense experience, or from my side, the intense experience, before he introduces himself in a moment as an intro. I'm sitting in a cafe and I'm reading something. I often go there to read unpleasant things and I take the first sip and a tooth in my jaw here goes. Boom. It's like an explosion is happening in my head. And I thought to myself, stop. I have pulpitis, got some ice, and then I looked at the clock. Who can I go to? It was 5 o'clock. Dentists are usually gone by then. I call Dirk privately and say, listen, Dirk, I have this issue. I'm coming to you now as long as I can still drive while being conscious. I go to his practice. He drills the tooth. It was easy to find because it hurt. And then I was able to sleep again. I had the story. In film 166 that I couldn't sleep for 3 months. From 2 to 5 o'clock, I couldn't sleep. I had already mentioned in film 166 that I actually couldn't sleep for 3 long, painful months. I knew that if I went to bed at 2 a.m., I would be awake again. I didn't fall back asleep until 5 a.m. The next day, I had my practice and 2 small children to take care of. And I believe I was also the main breadwinner at that time. It was horrible. I didn't want to sleep anymore. He drills and I can sleep properly again. The next day, I go to him and say, hey, Dirk, I can sleep again. And he goes, who has the cards with the teeth? Hanging in the practice. And points to his own card. And interestingly, a colleague told me 6 months earlier, attention, and this is important for what Dr. Dirk Schreckenbach is about to say, a colleague and I had a moment of reason 6 months earlier in Berlin, and we decided to examine each other.
You had told me 6 months. Well, you can sometimes feel that way.
I didn't notice anything. The tooth had a crown on it and didn't bother me otherwise. But then it started to act up. Like the saying goes, a constant drop wears away the stone or makes the cup overflow. And now I have Dirk Schreckenbach here. Where are you joining us from, Dirk? Where are you right now?
I am currently in Holland and on my way here with you. Thank you very much for your invitation, dear Bite. You are here?
I had to wait until he came back from the USA. He is currently traveling all over the world. Good people are always on the move. And if you want to see him, then you go to Baden-Baden to Freudenstadt. Those are the naturopathic doctors, and you won't believe it. That's where the experts speak. That means, for example, the professors who specialize in specific topics like endocrinology and bioidentical hormones speak there. Why? Because people listen to them there. So, and when you mention Dirk Schreckenbach, you already know, yes, Schreckenbach, we know him. Dirk, please introduce yourself. What has your career been like? How did you get into all this naturopathic stuff? And before I give you the floor, I need to say one more thing. My grandfather was a dentist, and unfortunately, I have my own long dentist story. And I've only met 2 people, 2 dentists, who had the delicate, gentle hands and the thoroughness that my grandfather had. I saw an old picture where he is standing by his chair and still using the foot pump to drive the drill. Fortunately, I didn't have any major dental problems back then. And he's one of those, he goes in thoroughly and deeply and you hardly notice it because he has such a gentle touch. Well, I wanted to, but I can't advertise for you because here in Germany, you can't be reached anymore. It's your turn.
Thank you, dear BT, for the flowers. Yes, so I was in Baden-Baden, as you just mentioned, at the Congress, now at the Medical Week. Just a few days ago, I also spoke there. It was about the topic of fear and teeth. It was also very interesting. Yes, how did I get into this? It basically started during my studies. I was living in a shared apartment, and a colleague of mine said, "Hey, I have a course on homeopathy here. Why don't you come along?" And since my grandparents have always worked with these little white pellets, I thought it would surely be interesting. So I decided to give it a try. And there we had an old colleague from Trier, and that was Mr. Wolf, as far as I remember. He unfortunately is no longer with us. He presented this homeopathy in such a way that I said, wow, it just has to work. I mean, as I said, I already had experience with it as a child, but now experiencing it from a medical perspective was simply wonderful. So that's where it started. At that time, I didn't know diabetes yet, but I had another colleague who said, "Hey, I have mouth acupuncture, according to Gledick." And then I thought, what is this? Okay, I'll go check it out. And it was really interesting. Then I opened my practice in 86, and in 87, for the first time, in 1987, I went to Baden-Baden and entered a room where about 200 to 250 dentists and doctors were sitting, and someone was talking about the canine tooth and its connection to the eye. And then I said to myself, get out of here right away. What kind of bullshit is this? Sorry for using such harsh language. But the colleague's argument was so convincing that I said, come on, just like my mother always told me, if you reject something, at least try it when it comes to food. Yeah, boy. And then I thought to myself, okay, take this to heart, stay seated. And I have to say, since then this, I don't want to go into details, but I'll call it a medical virus, got me hooked, and I thought, wow, if that's the case, then you need to get more involved with it. So I was already in the first course for electroacupuncture, according to Dr. Voll. Homeopathy was also in demand, and so on and so forth. Long story short, I graduated in 1983, then spent a year in maxillofacial surgery as an assistant, completed my assistantship there, served in the military, and then opened my practice in 86. From 87 onwards, I continued my education in naturopathy. Then came what always happens when you treat holistically as a dentist. There are nice colleagues who come and say, well, now excluding beta, but who then come and say, why are you treating the liver? This is my field. This is I am the internist. And so I said, I treated the liver, I treated the canine tooth, and the canine tooth is connected to the liver. And then I gave liver drops to calm the canine tooth because these two things are connected. He didn't understand that. And then at the next training session, I met a fellow dentist who said, if you want to get out of this greed, just become a naturopath, then you can also practice general medicine. So that's what I did. Since 1992, I have also been a naturopath. And with that, the topic was settled. That means, to be more precise, I also studied medicine on the side. I wanted to mention my first great mentor, Professor Freitag, at the University Clinic here in oral surgery. But after I saw that he spends 60% of his time at the desk and only 40% of his time with patients, I said, this is not for me. I want to treat patients and do it the way I want. And that's why I left that path. So I only completed the exam for dentistry. And so over the years, starting as a student in Baden-Baden in 1987, I would say that by around 2000, I had become a teacher. So, since then, I have still been in Baden-Baden and also in Freudenstadt with the Central Association of Physicians for Natural Medicine, where I also give courses. Yes, and that is my professional story for now.
We have already had an intense experience together. I mentioned that you also worked on my tooth there. And what happens? 2 days later, he calls me and says, will you go with me to Fliege? I didn't know Fliege back then, but perhaps some of the older listeners might know him. There is a pastor who has skillfully brought difficult topics to the people through television. He tells me, oh no, I don't want to practice. But then, stop, 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 stop. He did something for you, so you must do something for him. So we drove there together and I thought, okay, they will sit there, I will sit in the front row. Patient, what happened? How are you? Blah, blah, blah.
And then I was done. They put me in the first guest seat, and Fleech had fun showing me all that who knows about teeth. Then
In any case, Dirk Schreckenbach was there and he recounted an event in the practice when he was still a young dentist. And this event shocked him so much and ultimately, I believe, paved his way once again. And there was this one elderly lady who suddenly couldn't see anything after the treatment of her canine tooth. Would you like to tell that story?
Yes. So I had an elderly lady with me who came in with only a few teeth left, including one with a cavity on a canine tooth. She wore glasses, and I asked her to take them off. I gave her an injection at the canine tooth so she wouldn't feel any pain while drilling. We treated the tooth. Everything was wonderful. Then she puts her glasses back on and suddenly says, "Tell me, why am I seeing so poorly all of a sudden?" And I said, "What, you can't see well?" "Yes," she said, "on the side where you treated the tooth, the eye, it's really bad. I can hardly see anything." And then I said that could be a side effect of the injection. Stay in the waiting room until the injection wears off. The injection wore off and she said, "Yes, it's slowly getting better." Okay, she came back a few days later because this cavity was very, very deep. I was very, very close to the nerve and had to reopen the tooth again. I said, "I'm sorry, we can't save the tooth anymore. We either have to, it's your decision, we either have to do a root canal treatment." I then listed all the disadvantages of the root canal treatment to her. We can still discuss it further if Bite wants. And then I said, okay, so the best thing would be for you to, I would remove the tooth. And then I said, after she said, again, let me try with the glasses, again after the injection. And then the eye got worse again. And then I said, well, I don't think it's the injection, but I believe it's the tooth. You remember I just talked about the first lecture I attended, canine tooth, liver, and eye. The eye is the sensory organ that is connected to the liver and the canine tooth. And I said I would strongly recommend that once we have removed the tooth, you go to the optician and have your eye checked. Said and done, the tooth was removed, but the eye remained poor, even with glasses. And she called me very excitedly in the afternoon, it was in the morning, and said, "You were right, you were right, you were right." Then I was like, what? How? Slowly? How was I right? She says, "I just went to the optician and I had about 5 diopters. Positive in one eye, so I am farsighted, and now I only have 3. So the tooth had already been a problem for a long time, because it had deep decay, a so-called focus, a silent area, did not hurt until the day it started to cause pain. So this tooth was already the cause of the eye reacting. And after this guilty tooth, in quotes, guilty, was removed, the eye got better. So, just take note of what all can originate from teeth.
And not immediately. What you didn't say is, if one eye gets better, then you can't see anything with the old glasses anymore.
Exactly.
What you experienced there, you probably went through everything. My emergency kit carries my liability insurance. What have I done to her? Maybe she will go blind. I just wanted to add that.
Yes, exactly.
Do you have more such impressive experiences?
That's the beautiful thing that that was like the initial spark for me, that I knew that what I was learning, like electroacupuncture according to full homeopathy, acupuncture, that all of it has its justification. A young man came to me, referred by a colleague I had met at a seminar. The colleague was from Trier. The young man had been having issues with his digestive system for years, mostly with the small intestine, but also including the stomach and the large intestine. So it was kind of a multicultural thing related to Crohn's disease and ulcerative colitis, which are inflammatory bowel diseases that are very unpleasant. He came to me, and the colleague said to me, "Please take a look and see if a tooth might be the cause." And we looked, and indeed there was a tooth, specifically the upper 5th tooth, counted from the middle. The 5th tooth, these are the teeth that belong to the so-called lung and large intestine meridian system, and it had undergone root canal treatment but appeared normal on the X-ray. Well, I put him on the test machine, on the electroacupuncture according to Vol, and I got what you can't really call a medication. In this case, it's a so-called nosode. A nosode is a medication derived from a disease. When I used the nosodopacum of colibacteria in the measurement circuit, the measurement result was positive.
Also, homeopathized.
Homeopathized, exactly. Of course, yes, sterilized, homeopathized, everything is wonderful. So I didn't do this on the person themselves, but within the measurement circuit. Okay, so it was clear to me that the tooth was infected with E. coli bacteria. But how do E. coli bacteria get into the mouth? That's not the usual place for E. coli bacteria. E. coli bacteria belong in the intestines. So I said, okay, I'll put it to the test. I then removed the tooth as much as possible. Well, not as much as possible. I removed the tooth, but I did it in a way that I wouldn't come into contact with the saliva in my mouth. I personally drove him to the microbiology department of the University Hospital in Hamburg and asked them to examine the tooth for microbes. And then the senior physician received me and said, "What do you expect to find there, colleague? You will find the oral bacteria." He said, "Yes, but I still want you to examine it. I want you to examine all the bacteria, those that live with oxygen and those that live without oxygen. These are called aerobic and anaerobic bacteria. And then please let me know what your result is." Long story short. After 3 days, the senior physician called, and before he could say anything, I admitted it. They found E. coli bacteria, and there was silence on the phone. And he said, "How do you know that?" Then I said, "Yes, I tested it." "Yes, how did you test it?" I said, "Yes, there are testing methods that can be used to test it." Sounds interesting. And that was it. I then received the diagnosis. All right, back to a patient who drove home after the tooth was removed, and the colleague called me 2 days later and told me that the patient had a pretty severe bout of diarrhea on the day of the tooth extraction, and since then his bowel has been fine and it stayed that way. So everything turned out wonderfully. The interesting thing is, in addition to his intestinal issues, after I gave him the injection for the tooth extraction, he said to me when I came back in after the injection had taken effect, "Hello, doctor. At first, I thought he might have some side effect from the injection, maybe something with his eye or glasses. No, he told me. He has a shoulder-arm syndrome." Yeah, who tells their dentist that they have a shoulder-arm syndrome? We usually don't ask that either, that. And he says that since they gave the injection, it has gone away, and then we should try it out. He figured it out himself, and I said, "Sure, why not?" I said, "I'll take the tooth out now. We'll sit in the waiting room for a while, and we'll wait until the injection wears off." The injection wore off, and the shoulder only went up to that point again. I then performed neural therapy again on the fresh wound. The arm went up again, and everything was fine. So this means the large intestine meridian system starts at the index finger, goes over the tennis elbow, over the shoulder, and to the tooth. So, long story short, the gut was fine and the shoulder was never an issue again. So, also consider the meridian pathway. And that was simple. Those were my initial experiences. With holistic dentistry...
Now, I'm going to hit you with a critical question.
Yes, please.
It is undeniable that teeth can ruin a person's overall health. In fact, just one tooth can do that. Yes. How can it be? What is your philosophical thought? How can it be that something like this happens, and it has happened to me more often? And I have also experienced that when I teach colleagues how to find it out, it happens to them too. Then they have this personal experience, kind of like saying, "You need to know that it's really there and now feel it too." How is it possible that a molar like mine, for example, can cause shoulder and arm pain, as you just mentioned, and that it lasts the whole summer without me having any idea about it? How can it be that a process in the body is so hidden, that there is calm up there and the person runs from doctor to doctor for years? How do you imagine that? Why has nature, which usually acts quite rationally, placed our head on top? Because the eyes are on top for orientation, the ears are on top, okay? But the sinuses are still on top instead of at the bottom so that the mucus can drain. So at some point, we must have walked on all fours. And the sacrum is also inserted from above, so it doesn't quite fit yet, but otherwise everything is reasonable. Do you have any idea? Why is it that people can be tormented for years without it being known? That there are methods to address it? Why doesn't a tooth just make itself known right away? "Hello, I hurt, take me out." What are your thoughts on this? Because this is something that really concerns me. And I always say, if I ever meet the Lord, I will ask him that. By the way, I will also ask him why he has installed at least 10 reflex zones on the body. On the hands, on the feet, in the mouth, on the ears. Maybe I have to sit for years? I need to be able to fetch. I need to be able to have fun too. But maybe you have another idea.
Well, I have various ideas about that. For instance, if we consider the intestines are also very richly supplied with nerves, with very fine nerves. If all these nerves reported what was happening in the intestines during digestion, we would have to curl up on the floor after every meal. We don't do that because of these pain sensors in the intestines. Yes, the pain sensors in the intestines are indeed present, but they do not react to normal activity. Yes, so this might be a bit of a strange example, but just to understand it. Then the brain itself, for example. So if I make a hole in the head and poke into the brain, it doesn't hurt. So the brain, when I make a hole in it, it already hurts, but the brain itself does not hurt. The tooth is very heavily innervated, meaning it is filled with nerves, and it has different nerves. It has one nerve inside and many nerves around the root. For example, inform the brain about the movement of the tooth or the position of the tooth. It is a very, very fine tactile matter. Now, one must understand that the basic system provides this. This is the system through which our cells are nourished. It is a tissue that is found throughout the body. This is naturally nourished by our diet, which in turn nourishes the cells and also absorbs waste products from the cells to transport them away and release them through the lymphatic system. This system is the same everywhere, whether it's in the dental nerve, whether you pay attention to it, or in the little toe, or in the brain, or in digestion. This basic system is everywhere. By the way, Professor Pischinger discovered this, just by the way. It's the same everywhere. So, my experience is just like yours. Dead or infected teeth generally do not hurt at all. That's why many patients have said to you and to me, why do you want to take that tooth out? Or how should I have that tooth removed? It doesn't cause any pain at all. Nature is a bit tricky, I would say. If every type of disturbance caused pain, as I mentioned, it would be like with the intestines, and we would just be running around screaming. That's just the way it is. This means that the body initially responds to chronic stimuli in a dull manner and first reacts as a regulation. Our regulatory system is very, very detailed and very, very beautiful, but it also has disadvantages. And the disadvantage is these silent inflammation, which do not react acutely to nerve cells. That means we only notice these silent inflammations when either an organ has already been affected or has been affected to the point where pain sensors or pain receptors have been triggered. And that is usually not the case with dead teeth, unless they develop an acute inflammation, such as an abscess, a swollen cheek, which really, really hurts. But otherwise, such a root-treated tooth, whether it is stressed or burdens the organism, is painless. This is our big dilemma. And since BT and I have testing methods that can prove that this tooth is indeed causing an issue, we are very thankful and very happy to have these testing methods so that we can help the patients.
You know, I'm just realizing something that actually deeply frightens me. The way you explained it so well, involving the intestines, makes me think that if we were aware of everything, we would be doubled over in pain after every meal. I am just now realizing that a malfunctioning intestine, which is our daily bread, goes unnoticed by the patient. His gut flora is messed up. It's not good, for example, through diet or even innocently through stress. He has damaged his gut flora to the point where his immune defense no longer functions properly, and he doesn't notice it. He only notices the consequences, namely that he is constantly getting sick, or also the topic that I deal with every day, which is hyperacidity. The patient only notices over-acidification when they develop neurodermatitis, or when they get migraines, or when their muscles become so stiff that they can no longer move backward and forward. That means, on one side, the body is apparently saying, look, I have carried you this far and will continue to carry you further and further. But when it finally ends, we don't get shown a red line. Instead, we get sick. And then people start looking around and thinking, okay, where could it be coming from now? What is the conclusion then? My answer would be to educate, 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 so that even more people know about it.
Yes, that's right. But coming back to the gut wall nervous system has more nerve cells than the brain. Let that sink in. We have microbes. The microbiome in the mouth and also in the gut is ultimately controlled by microbes. When we eat the wrong things, It is because our gut nervous system receives information from the bacteria that tell us to go to the drawer where the chocolate is, that we must do this now, and that we must eat something sweet from the fridge? Yes, because the bacteria send this information to the brain via the gut nervous system. And as I said, as I already mentioned, the pain sensors in the intestines are virtually non-existent. With teeth, when cavities directly and quickly reach the nerve, you notice it acutely and intensely. Or if the tooth is still alive, when I drink something warm or something cold, as you mentioned, I could jump to the ceiling. There's almost nothing worse than a toothache. But if it is a chronic process, like a creeping inflammation, the body doesn't notice it because it simply counter-regulates. Yes, because otherwise, as I said, we would just be running around screaming. And that is my reasoning for why it is so important, as you just mentioned, that we train colleagues who learn to look in that direction and simply find out. There are stuff connections, and they do exist. And is this one tooth or are multiple teeth involved in the patient's condition?
So I have this feeling, I met you in Baden-Baden during the Doctor's Week, and you have to say, for all the viewers, Dirk Schreckenbach was previously in Chicago because he attended a seminar there and was simply busy there. And he made a special effort, and I was actually very touched, to return for his lecture in Baden-Baden. He shortened and interrupted his seminar, so it was compatibly shortened, and came to Germany specifically for this. That means I see how important this topic is to you, and we are both kind of old-timers now. And so when I think about it, we still have work ahead of us because we need to continue training our colleagues in these methods. And if I may, I just want to say two things. One is, I looked around in Baden-Baden and there is this method, and then all the companies offering dietary supplements and so on. That's all well and good. But if, just as a comparison, you have a hole in your roof and it's raining in, and 1,000 companies offer you different buckets to put underneath, that's not the same as actually finding the hole. For example, I and he belong to the people who find the hole. Whoever repairs and treats it properly, that's him. That's someone like him. That's why I miss him so much, because he was in the next town to me, and I was also a patient there, and suddenly he was no longer there. So once you have established yourself as a dentist in Dubai, patients will come to you. And I tell you, people go where good medical care is. As I mentioned, we now have this powerful laser, 90 watts, which allows us to sometimes leave a root canal treatment in place. I would say the following: let's do another 10 minutes, and may I ask you here that we make a follow-up film afterwards, because you once mentioned that teeth and emotions are a topic. And I suggest that we make a separate film about it, so we don't pack everything in here and the viewer leaves not knowing what to do. What would be the consequence? You would advise the viewers to take, or what would you advise them to do to avoid falling into this trap? So my idea would be, for example, it is to be expected that it could be a tooth. That would be the only idea I have right now.
In any case, I would recommend to people who still have their own teeth. To put it quite bluntly, although dental prosthetics is also a topic, we can gladly address that next time. When people have root canal treatments, they should definitely be attentive. There are now very good diagnostic methods, even in what I would call conventional dentistry. The colleagues who place implants use this three-dimensional X-ray. I think that's very, very good because you can slice the X-ray image like a ham into different sections. The normal X-ray image is only two-dimensional, so that means it's just a slice of ham cut out from them. Yes, or cut out from a tooth. But I can't imagine, when I picture such a ham at the butcher's counter, a nice new Parma ham, and I want a slice right from the middle, that it's already moldy on the left and right because it's air dried and sometimes they get moldy. It doesn't say anything about the quality, but I can see that it's mold. I can't see that on the two-dimensional X-ray image. I only see the middle slice, which looks beautiful. In the three-dimensional X-ray image, I can also see the moldy parts at the end and the beginning. This means that the diagnostics are significantly better. Even then, it is still not 100% clear whether a tooth is devitalized or not, but it is an indication. Because, and here comes the crux with X-rays, as discovered by colleague Lechner in Munich, only when over 30%, that is, 1/3 of the bone substance is affected by this chronic inflammation, can something be seen on the X-ray? With three-dimensional X-rays, it is somewhat better. The rate is between 20 and 25%. Still very high, but significantly better. That means I would definitely do that. Then I would recommend, in any case, to consult a colleague who specializes in holistic dentistry or acupuncture and interference field detection. You should go there and say, I have, 5 different root-treated teeth. Could you please check if there is anything wrong? Then there are various testing methods. We can also do it next time. It can be done right in the chair. It doesn't hurt. Yes, it's a test where a paper point is inserted between the tooth and the gum. The paper point absorbs fluid from the gum. This paper point is brought into contact with 2 different chemical solutions, and they change color if there are inflammatory processes occurring. This is also very, very important information. So that means I don't need to pull the tooth out right away, but can first gather the information. And these are all things I would recommend. The second thing is, of course, to look for deep cavities and also to check for changes in tooth alignment. I can just add to what my dear colleague said in 2021. Here is, for example, my second book, which I wrote about teeth and the psyche. I also gave a lecture on this topic in Baden-Baden. It was about fear and teeth, specifically how to recognize fear in the oral cavity and in the teeth. This is a book where these matters are addressed. Each individual tooth is examined.
Reveal everything. Not everything, no, that's the teaser. You can all take a look if you're interested. Absolutely fascinating. I also want to point out that Dirk Schreckenbach wrote an article in the latest patient magazine, the magazine Dre 23, which you can find at Akupunktur Day. I'll display this text shortly. There you go to Patients and then to Patients magazine, where he has written a brilliant article about teeth and the psyche. My suggestion still stands that you promise me another movie. Okay, yes, exactly. Do you have one? Now finally show your book. The first thing you did was on every tooth. You have it?
That was just a very brief moment. I'll display it here because the link is underneath. There are all my books in case anyone is already interested in accessing them. That is, at the point Liz and Expert links, all the items are listed there. Yes, we can also maybe link to it in the video later and add one. And my first book, wait a moment, I need to get the picture. It has disappeared.
Provocative. I just read something that you will never learn from 90% of all dentists. Don't the dentists come at you with shoes and socks? Or is that the reason why you left Germany?
No, that's not the reason why I left Germany. No, definitely not.
But how does she react when you say something like that?
Yes, that's just a bit provocative, because it might make my colleagues pay a bit more attention to these things. Wait a moment. I'll just share the picture for my other book.
That is the first book there.
The first book. Now I have it again. Yes, there it is now. This is my first book. Every tooth is always connected to a whole person.
I can only recommend it. You approach the book so emotionally. You tell stories, and that's how people can remember things. I myself am a storyteller too, as I always show cases from practice. Your book is in my waiting room. The flyers are there, and if someone wants to know more, I hand them the flyers. And this link, you did a good job with it. I had nudged you a bit beforehand to compile all your information into one link.
Exactly. There he is again.
Yes, put it back in again. As I said, you do have it. By the way, the link also includes the option to book a consultation with Dirk Schreckenbach. I think that's very, very good. You can book a consultation with you, and during this whole Corona time, we've really advanced digitally. That's not even a question. I see this in coaching sessions, which are very intimate, even though you are sitting across from each other. The advantage of online sessions is that you can use your own chair and also enjoy your tea. Do you have the consultations which can take place worldwide? I think it doesn't matter where you are traveling right now, and take good care of yourself because you still have to continue your mission. That's what I would like to point out. And you also have a seminar in there which can be booked, a webinar for people who are interested. And I know that among the viewers, there are colleagues and also dentists. Dirk, do you have in your collection right now, because last time I was asked about the 166, do you happen to have an overview map that you could display? For example, according to Voll and Kramer? Do you have something like that in your collection?
Wow, I really got caught off guard there. I need to figure this out now.
Let's point out that Dirk Schreckenbach will write another article about teeth for us in the next Patient magazine, issue 423. And I plan to introduce such a board there over 2 pages. So once again, go to Acupuncture D and then click on the tab Acupuncture Patients. And there you will find the library. In the library, you will find journals, including Journal 423, along with many other good pieces of information. The magazine 423 will include a new article by him, and it will contain this card. I think Voll and Kramer have no objections to their card being published there with full name disclosure, without making it seem like covert advertising. I can easily look that up for you. I don't have it on hand at the moment. Give me the table later, and I'll fill it out completely. It won't take more than 2 minutes. That's good. We'll do it right away because these illustrations are also in my books, as they are simply important.
You always have to be able to hit there again and compare what is there. Which tooth is just going there? I've had elbow problems for years now. My orthopedist says it's tennis elbow. Yes, maybe it is indeed one of the lung large intestine teeth that has been root treated and is causing problems. And I would like to tell one more story, very briefly. So if a woman is watching this, who might have a very unpleasant breast disease, she should always check if she has root-treated molars, specifically the 6th teeth, which are the first molars. In my 40 years of practice and 35 years of practicing holistic dentistry, I have never seen a single woman with breast cancer who did not have a root-treated molar. Whether it's the upper or lower, it doesn't matter. This is not a threat or fear-mongering. It's simply about being aware that the stomach meridian runs through the nipple. By the way, this applies to men as well. It's not just women who get breast cancer. Men are increasingly affected too. And just pay attention to this because the first molar, the 6th tooth, is the first molar that accompanies us into our new life after our baby teeth. And it has the longest lifespan, so to speak, in the mouth. Therefore, it very often has cavities. So please pay special attention to it, especially for women. It's just important to take care of your teeth. But I mean, this is just a placebo, what I'm saying here. No question about it.
I would add that I just had a realization. The 6th tooth was mentioned in relation to breast cancer. It is also the tooth connected to the liver, and the liver is associated with suppressed anger, which are related. And when the liver is overloaded, it damages the 6th tooth. And when the 6th tooth has a problem, it damages the liver. So white water. And with women who have carcinoma, we often see that they are women who do a lot for the community, who are completely overwhelmed, with 3 children, single mothers, still saying here in kindergarten, when the question is, who will bake a cake for the next weekend? So these are the limits. And at the same time, I naturally agree with you. If the tooth is infected, it has to go. Yes, it must go away completely. My suggestion is that you now tell us, Dirk, how you would revolutionize the medical system if time, money, space, and resources were no object. Yes, you could do anything and money wouldn't be an issue either. Yes. How would you change it? Especially in terms of dental interference fields. How does someone eat? What does someone do? What do you think is a plausible way to encourage someone to make changes before they start experiencing symptoms? That was also your perspective on naturopathy. As I said, you have all the resources in the world at your disposal. You should implement it now. What would you implement?
First of all, I would completely change the 2001 training system for us dentists and doctors. That's what I would do first. The first. How? Well, I would do it the way it was done before. In the past, doctors studied philosophy, theology, astronomy, astrology, and medicine.
Okay, I won't do it anymore.
Yes, you still like it. Then I would also introduce that those doctors and dentists who want to become doctors should do at least 1 year of treaty service in the hospital, and that at all patient beds. So, freshly operated, chronically ill, mentally ill, and above all, the dying. And if they still want to continue the profession of a doctor, then please let them do so. But I am confronted, and now I ask my colleagues for understanding, but I am confronted at times with so much medical, I'll just say it as I mean it, specialists who no longer see people as humans, but only as a stomach, a liver, a gallbladder. And we have in the courses, and I have in my courses, so many surgeons sitting there who say, I am so fed up when I come into my operating room in the morning and what do I find there? There is the gallbladder for you, professor or doctor. I say I don't want to know if it's the gallbladder. What is the patient's name? Where does he come from? What has he done? Why did he get so angry? Exactly that. So, with the topic of philosophy and psychology, which I mention in my second book, the emotional connection with the patient has, in my opinion, been completely lost. Especially in the last 2 years, it has become even more so. The digital world has indeed helped us a lot and also helps me with my online consultations. People are just much more open. Yes, they can join Zoom like we are doing now, and we can proceed. And people can just speak freely. They don't have the fear that I'll immediately grab the drill and start working. Instead, they can just talk about themselves. And the doctor is half the medicine. The trust in the doctor. I refer to your book, Dear BT. Love saves love. Yes, it's about love. Whether it's romantic love or not, it doesn't matter. It's about love for others and love for oneself. And as long as we as doctors do not have that, the love for ourselves, we cannot build the love for other people. And that is urgently needed in medicine, in today's medicine worldwide. And even if I won't get into trouble for that. Why? It's about love. Yes, exactly.
That's a cool conclusion. And Dirk, let's look forward to the next video, which will be about teeth and emotions. I am deeply moved right now because I feel so strongly how right you are, that philosophy and love are indeed such an important point. That means there is an emotion for the patient and it comes back from them as well. So it's not just about being grateful, but also about being seen. And from my side as a doctor, oh, thank you very much. I had the privilege to see you, and your example with the surgery and the gallbladder, wonderful. Dirk Schreckenbach, thank you very much. Wave to all the participants and encourage them to remember that the next time they have something, they should check if it might be a tooth. We are ending the video now and look forward to the next one. Thank you very much, and I wish you a healthy, good time. Spread your knowledge like a virus. Make it happen.
Thank you very much, BT. Thank you, Yusan.